Hey, Facebook fans, it's Jill and Dr. Cole here. So tonight we are going to have a little bit of fun learning about chiropractic care. So if you guys have some time tonight to join us, please do. We'll be looking for some suggestions for future video interviews. So if you have any, please put it in the comments. But tonight we are here with Advanced Animal Chiropractic, specifically Dr. Cole. So it's Dr. Cole and Dr. Tully that both work for Advanced Animal Chiropractic. So Dr. Cole, thank you for joining us.
You're welcome. Thanks for having me.
Yeah. So if you could tell us a little bit about yourself and what your background is and what made you decide to work with animals.
Sure. So I am originally from Michigan, and my dad is actually the co-founder of Michigan Animal Adoption Network. So I grew up spending a lot of time around animals and volunteering and that sort of thing. So we were just kind of inundated our whole lives with pets. And I'm sure like 95% of the female population growing up says they want to be a vet when they grow up. And I was no different than anybody else in that sense. And it wasn't until college when I spent a lot of hours shadowing a couple different veterinarians that I realized the whole vet thing was not for me, mainly because I passed out multiple times during surgical procedures.
Queen stomach, do you?
I do not have a strong stomach in the slightest bit. You know, ironically enough, I had no trouble in cadaver lab with humans, but with animals, I just can't do it. It's not in the cards. So I would say after like the third or fourth time that I had cracked my skull on a floor from fainting, I had like what I like to call my come to Jesus meeting, where I kind of sat down and said, okay, if I can't do this, what can I do? And I think I struggled with that for a while, but ironically enough, I just happened to be involved one day and went to like a graduate school fair when I was at Michigan, and they had a ton of booths for chiropractic, and one of them was entirely dedicated to animal chiropractic. And I felt like Jesus was coming down being like, this is your sign, like, go talk to this lady. So I did. And so you can either be a vet or a human chiropractor first, and you get that degree. And then after the fact, you can go do training for animal chiropractic. So I think it was probably even that night or the next day applied for chiropractic school at a couple different places. And I ended up going down to Georgia for chiropractic school at Life University. I was there for just under probably like 3.5 years, I want to say. Came back here to do my internships and like the hours that we had to complete working on humans. And then as soon as I graduated, I literally just signed up for the animal chiropractic program and kind of just bided my time working on humans before I could go get that done. And then once I finished that program, I think it was within maybe 3 or 4 months, I had completely stopped working on people. So I remember during chiropractic school, human chiropractic school, people thought I was nuts, including my husband. So it's my not husband at the time. But before we even started dating, he said he'll never forget. I was the girl that stood up and said, I'm here because I just need this degree so that I can then go get certified in animals and work on them for the rest of my life. And he was like, we all thought you were crazy. You know, so it's fine. No big deal. But
I can totally relate to that. That was me at naturopathic school.
Yeah, it doesn't surprise me, but there's such a need for it. And, you know, I don't care if other people think I'm crazy. If you can have a dentist and a chiropractor on every block, why on earth can't you have an animal chiropractor servicing like half of Michigan? So I don't know. I think that I'm the type of person that once I'm pretty driven, and once I know what I want to do, I'll make it happen. So that's kind of our story. And after I got certified, I just kind of hit the ground running and contacted as many veterinarians that would listen to me and as many like animal people that would listen to me and just kind of said, hello, I'm here. Like, this is what I do. I can help your pets.
I love it.
Yeah.
So you went to University of Michigan, then you went to Life University. Can you tell us a little bit about your certification program that you did for animals?
Sure. So there are,
I know there's a couple out there, but
yeah, so there's a handful of them. I went to Options for Animal in Kansas. So they are actually, I'm not sure if they're the original, but they're one of the original animal chiropractic places. And when I went, they were only teaching animal chiropractic, but I believe now they even do acupuncture too. They've expanded quite a bit. They're the biggest one. I think their classes are the biggest and they offer the most classes. Like a lot of the places will offer like weekend seminars or a lot of online work, whereas Options, I mean, it is hands-on from day one, which personally, I think that's the only way you can learn. And I want to say we were totally astounded when both myself and Grant went to Options. I would say my class was probably 80% veterinarians. Like there weren't nearly as many chiropractors in the class, which I thought was awesome because it really, I mean, we learned a lot from each other, and where one would struggle, the other one wouldn't. So it was great to kind of have that melding, and like all different ages too. I mean, people that had just gotten out of school to people that had been practicing for 45 years that just wanted something different. So it was really cool to kind of see how that program can reach so many different people. And I mean, a lot of them came to our wedding, like they're good friends to this day. And it's cool to have that because especially like in what you and I do, we don't know all the answers. So it's nice to be able to say, well, let me give my friend so-and-so a call. She's a vet and like, she might have, you know, some more insight as to whatever's going on with your pet. But yeah, so it was, I want to say 7 or 8 weeks total of just nonstop, literally 6 days a week. And then I want to say we were there from like 8 until 8 most days, studying and working, all that jazz. And it was pretty rigorous, but at the end of it, that's the other nice thing about Options is that they actually will have the International Veterinary Chiropractic Association, like certain board members fly in and you can test on your last day to get certified with the IVCA, which is a huge advantage to going, I would say, to that certification program, because the other ones we looked at, they don't offer that. You have to go find a time or the place where they're testing. And there's only 2 boards for animal chiropractic. There's the American Veterinary Chiropractic Association and the international one. So the American only tests once a year in Oklahoma on a very random weekend. And thus far, it has not been something that we've been able to make, but we are certified through the IVCA. So the testing is super similar. I mean, it's probably almost identical. It's just one, you're dealing with a lot of instructors from Europe as opposed to obviously Oklahoma. So it's super similar in that. And I would say that was another big point for us for Options is that there's only a couple schools that are recognized by the IVCA and the AVCA and the way like their curriculum, and Options was one of them. So that's why I was like, this is where I have to go. Like this is definitely the way in, and I loved it. I wouldn't have taken a minute back. We had a really good time.
That's awesome. Great. Thank you for telling me about that. I don't think a lot of people realize like your background and that you also, you know, you practiced on humans, and then there was additional certification that had to happen in order to practice on animals as well. So good. All right. So next up, we are going to talk a little bit about some basics. We've had a lot of new customers in the store lately that aren't familiar with chiropractic care for animals or had no idea that chiropractic care for animals even existed.
Right.
And then, you know, we do our best rendition at the store to tell customers like what they should expect or what their pet will experience. But I think you should give us a little bit more. I think you do a better job of sometimes explaining it. So if you could start with starting off with what exactly is animal chiropractic care? Like what is that? What does that mean?
Sure. So a lot of folks are familiar with human chiropractic, obviously. Whether they've gone to one or they haven't, it's something that's pretty well known. So the concept when it comes to humans is, I apologize, my dog's might bark in a moment, but either way, the concept when it comes to humans is all about structure. So you want to make sure that structurally you're sound and you're moving at an optimum amount, so that way you don't have areas that build up with inflammation. So what a lot of people don't understand is the reason arthritis forms is when you have two joints or two vertebrae in a joint that isn't moving properly. Your body's natural reaction to that is to form bone to kind of aid in that weight bearing. So that's what arthritis is, right? You're just forming this extra support system since your body isn't structurally sound. Well, there's no reason that like a 3 or 4-year-old pet should have that. You know, they should be moving well and not have all this excess bony formation. But what we see a ton of is this excessive amount of arthritis in these very young animals. And I truly think it's because they are so crazy at these younger ages that they end up developing it a lot earlier. But anyways, that's beside the point. So it's all about structure. And when it comes to our pets, it's no different than humans in that, you know, they're weight-bearing creatures. They put their body through the ringer. They play hard. They do somersaults. They run into walls. They fall down stairs. All of those things have to have an impact on their body, right? Like you don't just crash into a wall and walk away and you're like, oh, I'm all good, like no big deal. I mean, that's going to do something to you. And it's not necessarily the one time that happens. It's the hundreds of times that happens. It's kind of like when a human goes to pick up a laundry basket and they blow like their back out. It's not the 3 shirts that they were picking up. It's the fact that they've literally picked up that basket incorrectly for, you know, 400 times. And that time just happened to be the straw that broke the camel's back. So it's super similar with animals in that sense. The only difference is they can't even really tell you at the start of their symptomatology, right? Like they might be achy or know that something's off, but they'll hide it. So it all kind of goes back to in the wild, you know, animals, the weakest one doesn't survive. Like that's just how it works out there. So as much as our dogs have become domesticated, they still have instincts. You know, you can try to make your dog vegetarian, but I guarantee you, if you throw some raw meat in front of that creature, they're going to go eat it. You know, that's survival. And it's survival of the fittest with these guys. So they inherently know that if I show weakness, I could get left behind. You know, I could be the one that doesn't make it. So even though they live in the comfort of your home and they get a meal or 2 a day and, you know, they get lots of snuggles and pets and walks and whatever, that doesn't matter. Like instinct still takes over. They can't show you that something's wrong until it's really, really wrong. Usually by the time you're seeing symptoms of something, it's been going on for a while. It's not something that like that you flip the switch and something was wrong. It's the fact that they've hidden it from you as long as they can, and their body has just compensated and compensated and compensated, and it can't do it anymore. So the reason like chiropractic works is because we focus on structure. Our whole purpose is to instill motion in the joints, right? And to make sure your range of motion is good, you've got good joint play, all that sorts of things. Like we're trained in palpation and making sure that everything is like a smooth system throughout. So my job is to go through and find those joints that aren't moving properly and just restore it back to what it should be or closer to what it should be. Where we really differ from human chiropractic is how it's done. It's so gentle. We kind of have to warn people, especially those that are so used to snap, crackle, pop chiropractic. It's not like that. You know, you can't come in. We don't ask our dogs to get on a table. We don't ask them to lay on their sides. We don't do anything like that. There's no gross manipulation. It's very precise. It's very gentle. And it's very quick. You know, it's not something where I need to have, you know, now relax, puppy. Like none of that has to
Take a
happen.
deep breath.
Take a deep breath, wiggle your toes. Like that doesn't have to happen for our pets. And what's funny is I'll have a lot of folks that are really surprised because their pets will come in and either they're usually very anxious or nervous or there's all these different things going on, but for some reason they just settle very quickly. It's again, it's that instinct. They kind of know that I'm not there to hurt you. I'm not going to hurt you. You're safe. Like it's going to be okay. And then usually halfway through your dog's just like melting like butter. So it's pretty cool to kind of watch the transition for them. I mean, the perfect example is some of the canine officers we work on that are very high strung. They're supposed to be, they have to be high alert and they are chill as can be, very relaxed, shockingly. And they let they let someone literally touch them from nose to tail and they don't complain about it. They relax, they let it happen. And then they're back to being high strung, after they're done, they're ready to go. But but it's like, it's pretty cool, So so animal chiropractic, similar to humans in concept, totally different in modality.
Yeah. And I agree with you. A lot of cats and dogs are very stoic. They don't want to show pain.
Yeah.
Like you said, the weakest one, especially if there's other pets in the house and there's a weak link, sometimes that can lead to disruption in the pack or pack fights and things of that nature. So of course, dogs more than cats. Cats tend to hide where dogs become very stoic.
Right.
So yeah, absolutely. Sometimes we don't, and sometimes it's, maybe we could talk about this real quick too, is we've heard it from customers where it might not be pain related, but maybe the dog isn't acting normal. Like it's out of characteristic. Like they're not jumping on the couch or they're not able to do like 2 steps into the back of the house or, sometimes it's like so minor what we hear that the owner sees.
Yeah.
It doesn't have to be something like dramatic, or it doesn't have to be a big tumble or fall. It could be, I mean, Lord knows we could roll out of bed. Like you said, the laundry basket, you roll out of bed wrong in the chiropractor. So
no, it's very similar. With animals, I would say more often than not, they might be coming in for something that's like grossly obvious, but a lot of times after they've started care, we'll get little comments like, she jumped in the bed for the first time and I don't even know how long. And I didn't really think that there was something wrong. A lot of times we get the phrase, well, I just thought they were getting old. Well, senior dogs do get old, don't get me wrong, but there's no reason to not try to see if we can help, because honestly, most pets don't just stop doing furniture and stop doing stairs. Like there's something that's bothering them and that's why it's not happening.
Right.
And honestly, just a little bit of motion being restored to certain joints can make all the difference in the world. Like it's crazy. I know just this last week, one of the labs we've seen for forever, Jackson, I'll never forget. It was probably a few months ago, maybe back in the winter. He hadn't been jumping into the car and she got him in and literally he jumped into the car as he was leaving. So it's pretty fast sometimes too, especially for animals that have been, seeing us for a while. Their bodies acclimate really quick to that new, like what it should be. Whereas like with humans, people think of human chiropractic care and they're like, oh my gosh, do I have to bring my pet in like 3 times a week for 8 million weeks? That's not how it is at all. It's totally different. Our pets don't sit at a computer all day and, sit there with their necks like this or hunched over, and they get up, they move when they want to, they sleep, they have really good awareness of their body. Like they'll do yoga throughout the day. I mean, when's the last time you walked past a coworker and they're just like standing there doing some yoga? It doesn't happen. So they're really good about listening to their bodies. And I think that's why they do so well with chiropractic. But yeah, the simple things like hesitation on floors is a big thing. Like, so few people have carpet anymore. It's not a common thing. Most of us will
especially
have
in a dog home. Yeah.
Sure. Most so even just like years of walking around on tile and wood floors, like that's taxing on them. I mean, in the wild, they'd be on grass and in wooded areas and cement. It's not, they wouldn't be on your wood floors. Like, this is a whole different ball game for them. And so that can have a huge part in it too, and just aging them faster than they need to. Not to mention, I mean, diet's a whole thing. We can get into that another time. But like, if you add all these different things together, it all contributes. And like, I would say stairs, furniture, getting in and out of the car. Like you said, if you've got a couple steps in and out of your house, if your pet's not wanting to do that, those things are all, that's almost like their early symptoms, right? So they're not limping, but that's a symptom. Like, that's something that we could potentially work on and fix. So if they're not showing you their weakness, that's kind of their first way of maybe showing it to you that, hey, something's not quite right, but I don't want to limp just yet.
Right. So I did pull up a picture here. I'm just going to share it real quick as well. So some people don't realize that, we get that question a lot, like, how does chiropractic, what does that look like in the consultation?
Yeah.
So this is a picture of Dr. Cole adjusting an older dog. And as you can see, it's, the dog's standing on the floor. We don't have a table, or we don't have any high place for the dog to stand on. And a lot of, like you said, the dog's just, you don't ask him to take a deep breath and turn in 2 different directions.
Right.
To adjust the spine, it's, going down the spine. It looks like here you're helping out in the front legs. So a lot of people don't, that's a question that we get most commonly at the front, but we also hear the tail end of it too, as a customer or client comes out to check out with us, and sometimes don't hear those comments that people will say, like, I feel like my dog is already standing better, or they seem like they have a little bit more pep in their step.
Yeah.
Or like, if the dog jumps up on the owner, we've seen some agility dogs or trick dogs where they haven't greeted the owner in the same way, and all of a sudden they're bouncing around and asking for rewards and pets and things like that. So those are some of the things that we see after, even just immediately after an adjustment. So cool stuff.
Yeah. And also, you guys have I always direct people to your YouTube. You guys did a video when I first started out of me adjusting a dog, and it's probably one of the easiest things to look at, to just kind of see what it's all about. Now, granted, Corbin was a very calm and relaxed. Not everyone is like that, but the adjustments are all going to be very similar in how gentle they are. So it's a good thing if you just, literally you can hop on the Pet Bistro's YouTube page and find it through that. Or you can literally just like Google animal chiropractic or dog adjustment, and I think it pops up.
We have the Tango one too, which people don't realize that you can do pretty much. So tell us a little bit about that. I know you always kind of mentioned it's pretty much anything with a spine that you can adjust. So besides cats and dogs, you guys also frequently adjust horses.
We do.
And then I know you've had some experience with some other mammals.
Yeah, we've had some really interesting ones. So we've worked on guinea pigs, and we've worked on rabbits and goats, steers. We've worked on, what am I missing?
Like a random squirrel, or
we've worked on a couple squirrels. We've worked on, you and a raccoon, on a baby raccoon. You honestly could. I did get a call about a bird. Actually, I have worked on 2 birds. I did have to do a little bit of studying on anatomy. It was weird, but it works. I've done a pig, and I did get a call about a fish. I don't know if that was a prank or not. I think it might have been, but I have not adjusted a fish. I don't know if it's possible. But I would,
your resume though.
it would be interesting. I would totally be down. I know we have some friends that have adjusted exotics that are vets at a couple different zoos.
Okay.
So it would be so cool. One of our classmates is a vet, I want to say one of the Ohio zoos. I can't remember which one. And she's worked on a couple different exotic animals, which is super cool. So, and I know earlier this year, a gentleman in, it might have even been Ohio again. I don't know why Ohio is so progressive, but they, I think, had him do a hippo, which I think is like the coolest thing ever. But obviously they have to be a little bit more sedated. You don't have to sedate the other ones that we work on, but with those guys, like it would be super cool. I mean, I'm here, Detroit Zoo, if you need me.
Hey, you never know.
You never know.
All right, so let's talk a little bit about appointments. So we talked a little bit about, the dogs are standing on the floor and there's not a table and it's pretty mild, but can you tell us like what should people expect on the first, like a first consultation? So we typically call that an initial appointment because that's your initial meeting of the animal.
Totally.
And what actually happens during that appointment? I know some people ask if there's an adjustment. I know in the human chiropractic space, sometimes the meeting and the initial appointment doesn't include an adjustment. So sometimes there's some confusion there as to what happens during your initial appointment. So if you could tell us a little bit about that.
So when it comes to the animal's initial appointment, it usually runs between, I would say, 20 and 30 minutes, depending on what's going on. We take a full history, that's relevant to what we need to know. A lot of times we've actually talked to most of these people on the phone ahead of time too. So we're a little bit more familiar with the cases, but, we take a history. We do a full once over with them walking. We want to do gait analysis. They do get adjusted on the first day. So where it differs a little bit again from humans is that we do coincide with veterinary care. So if it were anything that would require x-rays, they've already had that done. And most of the time we've already been sent those to take a peek at. And truly, unless there is something that is contraindicated, like if we have a dog with really bad bone cancer or something like that, we would just not adjust that area. But the thing is with animals, our adjustment is so much based on feel and palpation that x-rays aren't necessitated, where a lot of times with humans they are, just because it's just and there's so many different techniques in the human world too. With us, it's all manual, everything's done by hand. So we're pretty attuned at sorry, my dog's reverse sneezing, everything's good. But it's pretty much all we're pretty in tune with the movement and the motion and making sure range of motion is all there. So we kind of do a really good once over, but they all get adjusted on their first visit. I mean, I think it's super imperative just so the animal gets comfortable with you. A lot of times we get asked about, people who have aggressive animals or dogs that don't like to be touched and whether or not Grant and I will work with that all the time. As long as owners are willing to work with us, we're happy to do it. Very rarely is it something that we can't work on a pet. If it's something that's pretty aggressive, we just ask that you either muzzle them or be willing to have them muzzled. And we never really work beyond the comfort level of your pet. So I will say that sometimes if there's a pet that's very nervous and they're doing well, the last thing we want to do is push them past that comfort zone so that they have a negative experience with us. And sometimes this will happen with dogs that are in pain too. We're going to do everything we can, but we're never going to push them beyond a boundary. So we do see a lot of hot disc dogs and hot, bad pinch nerves. And sometimes that first visit is really, really focused on, muscle work, soft tissue work. And we'll do everything we can as far as adjustments go, but I'm not going to force something, I'm not, no way, Jose. So we're really good about working with their limitations and then happy to send people home with, at home recommendations too, that they can do in the meantime to kind of help the situation out. And then obviously it really helps being at your guys' store just because you guys have a whole slew of things that are really great for pain and arthritis and you name it, you guys have it. So it's nice to be able to be and since, we can only do so much, there's also things that can really help you guys get out of the woods. So it's usually, like I said, between 20 and 30 minutes, depending on if you get Grant or myself. And we're pretty dang thorough. So it's one of those things where you don't need to worry about something not getting done. It will. And we always send out a report to you guys afterwards. So that way, because like we tell you, it's so gentle and underwhelming that we don't want you to be like, well, did you just pet my dog? Yes, I did. But there are other things I did too. And here's this report detailing everything that we did. And then a lot of times, especially for that first visit, it can be really overwhelming just because you're getting thrown a lot of stuff at you, especially if we're talking about supplements and exercises and describing how to do exercises. Like, it's very easy to just, go back to your report when you get it and say, oh, this is what she said, or how many repetitions, or if for whatever reason we forget to, write it down, people can always reach out. We're pretty good about being responsive.
Good. And so, so that's an initial appointment. So an initial appointment runs 20 to 30 minutes. And the initial appointment, the cost of that is $90. Mm-hmm. And then, based on your recommendations, so, like you had mentioned earlier, it's not the only time that you would maybe see a dog multiple times a week. From what I've experienced with your recommendations, is usually if there's a paralysis or a severe, like, traumatic injury that has happened.
Totally.
But what is typically, how often does a dog need to be seen, and what does the follow-up appointment look like?
Sure. So what we kind of use as our gold standard is 3 adjustments. So a lot of folks, again, kind of think of human chiropractic and how often they need to go in order to see results. With pets, it's not like that. There's no placebo effect. So either your animal is going to improve or they're not. That's why we always say it's kind of worth a shot, because again, 3 adjustments and we should know if we're at least moving in the right direction. If you don't see any change, I mean, it could still be mild, but as long as there's some kind of change within 3, we're at least moving in the right direction. If you don't see anything at all, like if you really haven't noticed any changes in your pet, we're pretty brutally honest and we'll help show you the next stage of where you should go. So whether that be focusing more on laser or acupuncture, or let's do other supplements or whatever, but we don't want you to waste your money with us when you could be putting that towards something that could actually be helping your pet. I mean, chiropractic's not going to hurt your pet, but if there's something else that could be doing something exponentially more helpful, I'd rather you do that, And so yeah, there's really it's not like you have to see me for months and months. It'll be 3 adjustments and we'll know whether or not I'll see you again. But I would say that every pet's a bit different. So if you're extreme in the fact that you have like a really hot disc or you've got a paralysis issue going on, most of those cases will have you come in twice a week for those first 1 or 2 weeks until we kind of see where your pet's at and the issues calm down. Outside of that, dogs that are limping, things like that, I mean, most of the time we probably see you maybe once a week for 2 weeks. We try to get those first 3 adjustments in within 4 to 6 weeks, I would say, pretty typically, unless we're working with like a puppy. Something like that is a little bit different. And again, that's a whole different ball game. Or if you've just got a very healthy pet, you just want maintenance or preventative care, I don't need to see your dog 3 times within 4 to 6 weeks. It's different for those guys. But I would say if you have like a symptomatic dog of some kind, most of the time we want you to try to get it somewhat back to back like that, because we tend to see the most improvement if we're going to get it in that like time frame. And we work with people. We have people that drive from all over the place, and I get it. We don't have locations that are super close to everybody. So you might be in your car for a bit, but if that's the case, we'll try to work with you to make it best for you guys. But that being said, we're still going to give you our recommendations. Whether or not you guys follow them, that's up to you. But it's usually not something that you need to have like a repeat thing in your calendar. It's pretty quick to know. And then I would say most of our clients, when you get to a level of, you've seen the improvement, they're back to normal, they're really, really good. We try to tell you, depending on the age, maybe get them checked out once every 2 to 3 months. It really depends. Like if you have an older dog, it's probably going to be a little bit more frequent. And most of the time, those owners are the ones that kind of dictate the care, not really us, just because they are so in tune with their pet. So they know when they're slowing down or something's wrong, as opposed to people that are just coming in for checkups and wanting to make sure their dog's moving smoothly, like those guys, it's kind of nice to just have a general benchmark. So that's why we try to keep people on like a quarterly adjustment. Easy peasy. We can keep your dog on track. Like that gets you through the seasons, maybe for a little bit more often just because of the ice factor. But outside of that, it's usually not something that is so repetitive that we see you all the time.
Good.
And those are only about 10, 15 minutes, depending on how wily your pet is, usually about 10.
Yeah.
Those run 55.
Perfect. So some other questions we had, maybe this is a good one just to do like a quick bullet point type list, which Rachel here, she's been hanging out with us.
Sure.
And she's asking, as a pet owner, how do we know if our animal needs chiropractic care? So I was hoping maybe you could just do like a quick bullet point list of like things or reasons or conditions as to why people would come to see you for chiropractic care for their cat or dog.
Sure. I would say the bulk of what we probably see is older pets. If you've got pets that are older or arthritic, 100% your pet can benefit from what we offer. Younger pets, it's not a bad idea. You see how they play once in a while, getting them checked out is
pulling on their collar.
Yeah, pulling is huge. People wonder how their dogs get pinched nerves later in life in those front legs. I mean, it's 99% of the time, I feel like it's got to be coming from that collar and pulling on it. And harnesses are great, but they just move the pressure to a different area. So a lot of times that still impacts the shoulders. So obviously, if you've got a symptomatic pet, limping, lameness, pain, arthritis, God, I can get a little bit more in depth, like ear infections. We see a ton of ear infections, and they do awesome with chiropractic care. Seizures are kind of hit or miss. A lot of times, if they are coming from a structural imbalance, they do awesome under chiropractic care. I found that they either really improve or you don't see any change. But again, worth a shot a lot of times with seizures, and there's a lot of supplements and like diet changes that can help that too. But I'm digressing. I would say if you have more than one dog or cat, you probably need to get your pet in for care just now and again to get them checked out. Some really common conditions we do work with are luxating patella, cruciate injuries, sprains anywhere in the hips, hip dysplasia, elbow dysplasia, pinched nerves, discompression, IVDD, paralysis. We see a ton of paralyzed dogs. Let's see. Vertigo, doggy vertigo, vestibular. That's a huge thing. We've seen a big uptick of that. It kind of mimics a stroke, but 99.99% of the time, it's not a stroke. So it's something that chiropractic can help a lot with, kind of linked to the ear infections. A lot of times the two go hand in hand. And oftentimes, like pets that don't have seasonal allergies, like if you have a dog or a cat that's suddenly got a hot spot or they're licking a lot of times that's a sign of a pinched nerve. Same thing, it sounds goofy, but sometimes pets will look back at their back end like as if something happened or like, something bit them back there and they're totally fine. A lot of times that's the same thing. It's like a pinched nerve going on. And honestly, one of the easiest things to do is just like visually look at your pet. If you have a dog that when they're standing, their top line raises at all or has any kind of a little bit of an arch, that shouldn't be there. They should be flat, So if you see any raising up of that top line, that is a huge benefit from chiropractic. Like we can fix that. We can work on that. So, there's a whole slew of things. It's probably just as easy if you ask about a specific condition. Probably help.
Well, I think we'll have plenty of conditions to talk about. So I'm going to add to your list though, because these are some of the things that we've been recommending chiropractic for. It seems like lately that we've had kind of an uptick with urinary issues. So kidney disease and incontinence is a huge one.
That's a big one too.
Yeah, incontinence is a big one. So, and that's cats and dogs. That's both urinary and stool incontinence. Yeah. Just because the sacrum is typically out of place.
Just
constipation. Cats are usually have constipation issues or they have hairball issues. extreme vomiting issues, like if there's, if you had diagnostic testing done and there's nothing there, sometimes the stomach is shoved up in the esophagus. So getting that back in alignment and getting the stomach put back in place. Skin crawling or rolling, especially in kitties. There's typically like a nervous condition that goes with that. So oftentimes it's pretty extreme measures. They'll put cats on anti-seizure medications and some of these really powerful
meds,
prescriptions that they may not need to be put on if you get the spinal alignment back in place. So falls,
jaw things. We do a lot of jaw work.
TMJ, yeah. So cats don't always land on their feet, believe it or not, as much as people would like to think that. So if there is a hard fall or a cat's fall out of a cat tree or our cats have fallen off the wall shelves, we've had numerous fun. I know this is something you've mentioned before. Any dog that has like an elongated spine or a smushed spine, obviously the spinal column is not, it's compensating.
Yeah.
Totally. It's compensating for whatever that breed is. So that could be something to consider. Trying to think of some of the other things that we've recommended. Ear infections, of course. I know you mentioned that one. That one's fantastic. I think that kind of finalizes my list. But yeah, no, this week has been a lot of cat things have popped up this week. Which I found real quick a photo of you adjusting Rin when he was still not a kitten. Look at this little nugget.
How tiny he was.
So cats totally can have chiropractic care, and they usually, this is Rin. This is pretty much him falling asleep, getting chiropractic done.
Totally.
The other one that I wanted to mention too is sometimes deformities. So dogs either that have had surgeries and are tripod now, or dogs that have rescue animals that are born with deformities. I know you have a couple cats too, but those can always benefit from chiropractic care. So yeah. All right, good. That was a good list. I think we got quite a bit in there. All right, let's see here. So let's go back over here to my banners real quick. Any side effects? Can you think of any?
Sure. So what we always tell people is that your pet will probably be pretty sleepy after they get adjusted. That is totally normal. Please don't be alarmed by it. It's kind of like if we were to go get a massage, you want a nap and you want to drink water. Same thing for our pets. Like a lot of times they'll be very sleepy and they'll drink a ton of water. Now, what's funny is that our older senior pets tend to get more energized. It's like a weird opposite. You get one extreme or the other. Very rarely are they just kind of humdrum, same as always. So I would say, I don't really know that that's a side effect, but it's almost always what happens. So I would just say it's just what happens after you get adjusted. The only other thing is if we're working on a knee injury or something like that, we always warn people that for a couple hours, your pet may seem worse just because we've literally fiddled with all their joints. So if there's inflammation hanging out somewhere, it's supposed to be flushing out, at that point and dispersing. So you might have a couple hours where they're either more sluggish or more limpy, but it's very short-lived. And we usually just tell you to, get some ice on them and they'll be good to go. But don't be alarmed if something like that were to happen either. But that's pretty much all I can think of as far as side effects. We've had, don't mind the beagle in the background. We've had a few random ones where we've had a pet that's, I think it's only happened twice where we've actually had a pet that has vomited after the fact. And I don't know if it's just they were nervous or if they just needed to release something or what. And actually on that note, if we're working on a constipated animal, almost always they will poop. There are some pets that will poop immediately after they're done being worked on.
Right.
So other than that, I think that's pretty much it. I wouldn't think there's anything else that I can really think of.
Yeah. Well, and I was going to mention too, sometimes there's like there's some releases that happen. So maybe some extra stretching, like downward dog type or yawning.
Yeah.
Trying to release some of that
Totally.
tension that's hanging out there that needs to, like you said, disperse from the body. So
Yeah.
sometimes those are things that are seen or owners acknowledge that they're happening after the fact or even during sometimes.
Totally.
During the appointment. Good. So I think we covered a lot of our basics. Can you think of anything else that we need to talk about for overall basics?
Probably not. I would say, just so people are aware, there is myself and my husband, who just got home. If he wants to say hello really quick. Grant, you want to pop over? Just hair is not the best. So just say hello. Just pop over.
Hi, Dr. Grant.
Hello.
Good to see you.
There's both a male and a female. So I know that can be a problem for some pets, but we've got both. So
yeah,
it's helpful in that situation. And I would say, we don't fret if you have a difficult pet. We're used to it. It's not anything too tough for us. And right now with the way things are in the world, it's a little bit wonky, but we're definitely full tilt practicing and working. And obviously you can find us at Pet Beastro like 3 to 4 times a week, sometimes more right now. And we don't make you stay in your car. You can come in with your pet, like just so you can you can help us. But if nothing else, I think it's important that, you be there, unless of course you have an animal that is very protective of you, in which case maybe you need to stay in the car. But outside of that, I think we've covered a lot of bases. I don't know that there's anything I have to add right now.
Okay. So, and actually you kind of brought up a good point though, too. So if there is, again, right now we're kind of dealing with COVID, but even if we're not dealing with COVID and you have a dog that is older or very sore and painful, and you have a really hard time getting them in and out of the car, either one of our staff members or one of the doctors would be able to help you get your dog back in the car. If you're not comfortable doing that, or it's a large breed dog and there's paralysis, you or Dr. Grant would be happy to go out and work on the dog in the car as well. Especially a lot of people have an SUV nowadays. It's easy to, the dog's usually right in the back. You can pop the tailgate. You guys can work on the pet right inside the car rather than, coming in, because sometimes that's an exhausting adventure. And I've been there, done that with, a 90-pound greyhound where they haven't been able to walk well, or they don't walk well on the tile.
Yeah.
Or on the, the flooring inside the store. So sometimes just eliminating that part of the step can sometimes be helpful. So we're more than happy to work with you. Or if your dog is very dog aggressive, we can move people around the store. We kind of have a flow going right now, but we've had customers come through the back door even just to completely avoid all chances of seeing another dog or another person. So if that is the case, we can always make an accommodation to help you out and make that happen. So and yes, like you said, so you guys are at the store minimum 3 days a week, sometimes 4 or 5, depending on the week and what's going on. Anybody, I'm going to pop our phone number up here. Anybody is welcome to call the store for more information. Our phone number here, 248-548-3448. We can answer some very basic questions. I personally have had, I think Dr. Cole, you've adjusted pretty much every single dog and cat that I've owned.
And you and Lewis.
And me and Lewis. We're animals too. Yeah. No barking or meowing yet, but I think since we've met, you've pretty much anyone who has been in my home, you have adjusted. So I understand a lot of the process and what it helps and the natural things that go along with that and the benefits of getting the spine in alignment and supporting, nutrition, nervous system,
everything.
Walking, you name it.
If everything's moving properly, then everything should be working at an optimum. So all things affect everything else. You can't, if an animal comes in limping, you can't just work on that leg. You know, you've got to work on everything. Because
right. Well, and sometimes crazy enough, I always use the analogy because people kind of understand this, is that if you start walking or you go on a very, very, very long walk and you get a blister on your foot, you start compensating. So you start walking differently.
Yeah.
You're trying to avoid pain. You're trying to avoid causing more pressure on that blister that's on your foot, on your right foot. So you start walking differently. And then before you know it, your left foot or your left hip or your you know what I mean? Like the other side is now not operating correctly either.
Yeah, absolutely.
And sometimes it's not, it's your hip. It's not your other foot, even though that's the thing that's hitting the pavement. Your feet are doing the walking, but it's your hip because you've made so many adjustments to compensate for what's happening and to have 4 legs and all that happening.
Absolutely. There's a lot that can go wrong.
But I feel like a lot of people can comprehend that. A lot of people have had a blister on their foot and know what kind of pain that creates and what the body does to try to avoid that.
Yeah.
From doing.
Don't mind my beagle. Sorry.
Good. So anybody can come to the door. You can also visit us at our website, petbeastro.com. We have information about Advanced Animal Chiropractic on our website. We also have online booking. So if you go to the bottom of our website, there's a book an appointment button. You can click on that and see what their schedules are and what their availability is in store. So that is an easy way to learn more. And then, like Dr. Cole mentioned, check out our YouTube channel. We have quite a bit of information and some fantastic videos of what an adjustment looks like as well. So, and if anybody has suggestions for next week for topics, we are going to try and meet once a week and talk about some different topics. If you guys have anything that you're interested in, put it in the comments below. If there's any questions, you can put those there too. Myself or Dr. Cole will circle back around and we'll make sure that they get answered. So if you're watching this video later on and something pops up, just put a comment there for us.
Yeah.
We had a couple other folks joining us tonight. Janet says, hello. She was here with us. And then Rachel was like, this is so interesting, which I think it can be if people aren't, used to some of the natural modalities that we can do to help our pets out. And it's a different way of thinking. And we're so happy that chiropractic is an option here in Michigan for our pets. Yeah. All right. Well, I'm glad you were able to join us tonight, and we'll plan for next week again.
Sounds good.
All right. Thank you.